Hi, everyone. It's great to see you. We want to welcome you to Carolina and speak with you today about how to begin your individual path to a career in a health profession. My name is Mary Charles Horn, and I'm a health professions advisor here at UNC. And I'll let my colleagues introduce themselves.
Hi, everyone. We're glad you're here, even if it's a virtual here. I'm Joy Renner, and I wear a couple of hats here at UNC. I'm the director for Radiologic Science in the School of Medicine, but more importantly for you today, and related to today's presentation, I'm also an academic advisor over in Steele Building on main campus, and I work very closely with Mary Charles.
Hey everyone, my name is Malia Colden. I'm a sophomore here at Carolina from Fayetteville, North Carolina, and I'm majoring in medical anthropology.
Hi everyone, my name is Anna Wakita. I'm also a sophomore here. I'm from Plano, Texas, majoring in pre-health policy and management.
So today we're partnering with our academic advising colleagues, and you'll hear more about the academic advising program and course selection and registering in day 2 of your orientation period. But today we want to introduce you to academic advising because that's going to be a center to your support system here at UNC. We are everywhere on campus. You'll see that we have our main academic advising center is in Steele Building on North Campus, but we also offer a Hardin Hub on South Campus with different hours than what we have in Steele Building so that we can meet students where they are and accommodate changes in schedules and the busy active lives that our students have here at UNC. We also have a center at Loudermilk, which is primarily for our student athletes who may be listening out there. And we have lots of ways for you to connect with us. Some of you will make appointments with us, which would be for more extended time to discuss things about your major and course selections and a little bit more in depth about your academic planning. But we also have drop-in appointments for those activities that just require 5 minutes of someone's time and just a quick question for your advisor. There are workshops that will bring together groups of students who have like ideas about their majors or postgraduate experiences that they want to have. Students that may be interested in doing some enrichment programs. So lots of workshops that'll get students together with advisors to get even a stronger foundation of where they are. So as we work through this and continue to talk about health professions, and you'll talk with your advisors tomorrow, you'll find out that with health professions, particularly those of you who will be applying for a postgraduate type of health profession, we want you to know that you can major in anything here at Carolina. And we have more than 70 different undergraduate majors for you to choose. So please take your time, look through the opportunities we have here at UNC. And some words of advice that I usually give my advisees who are going to be applying to a post-undergrad program in health professions is, first of all, pick a major you have an interest in. One that you've taken a few classes, you can see that there's something's drawing you toward that major. Because if you pick a major that you're really interested in, one, you'll be very much more engaged and you'll do well in that major, but also you'll have a tendency to connect with the faculty more, get involved in their research, and those people will be valuable to you as mentors as well as writing recommendations for you for graduate school. Secondly, pick a major that's flexible enough that we can work with you and your major to make sure that you get the prerequisite courses that you'll need in order to apply to graduate school. And lastly, pick a major that if at the end of 4 years you say, I'm not ready for graduate school, I'm not sure which health profession I want to pursue, you can walk away from Carolina in 4 years very happy with your undergraduate major and feeling very secure in what you did during your time here at UNC and very proud of that degree that you're going to have that day. So academic advising can do a lot for you. One of the biggest things we're going to do is help you find resources here at UNC. There are many resources organizations as well as offices that are solely designed to help you be successful and to meet your own personal and academic goals. We'll discuss curriculum and requirements with you, help you lay out a plan for how to succeed in your majors. If you pick one major, 2 majors, if you do a major and a minor, we'll help you with that plan to make sure that you can meet all those goals during your 4 years here at UNC. We'll help you with thinking about course selections and helping you be broad-minded, much as the MC already mentioned, is making sure that you get a nice, broad liberal arts education as well as seeking your own personal specific goals. There's only a few things we can't do. We can't enroll you in your classes. That would be your responsibility to do that. Obviously, university policy and academic requirements are not something within the purview of the advisors to make any changes on. The university sets its own deadlines for registration and when courses begin and end. And as well as we will never tell you what courses to take. We will guide you in knowing all the variety of courses and opportunities that are out there. We'll give you advice and mentor you along your way, but you pick your path and your journey, and you're the one who ultimately selects the courses that you're going to want to take.
So as a pre-health student at UNC, one of the best resources that you have on campus is the Health Professions Advising Office. We're located on the ground floor of Steele Building on North Campus, and our role is really to provide resources to help you explore different healthcare professions and prepare to apply to a health professional school maybe after you graduate or as part of your undergraduate plan at UNC. We have a website, which is hpa.unc.edu. There's a lot of great information on it, and we hope that you can take some time this summer and familiarize yourself with it. There's a lot of different resources on there, and you can see programming that we've done in the past with different workshops and events. So take time to do that this summer.
And here at UNC, you do have a lot of opportunity to get yourselves engaged in a health profession at the undergraduate level. So some students will say, I want to be in healthcare, but I'm not sure I want to commit to those 2, 3, 4, 5, 6 years post undergraduate, and I'd like to get involved in healthcare sooner. And we do have several undergraduate programs that are related to healthcare. So some of them are in the School of Medicine. There's 2 programs, Clinical Laboratory Science and Radiologic Science. There's one in the School of Dentistry and Dental Hygiene. The School of Nursing offers their Bachelor of Science in Nursing. And over in the School of Public Health, they offer 4 undergraduate majors in biostatistics, health policy and management, environmental health, and nutrition. The most common path a student would take is during the first and second years of their years at Carolina, they would do their general education curriculum and complete the prerequisite courses for admission. Most of these programs, particularly those on the left-hand side of this slide, require quite a bit of math, biology, physics, chemistry, and we would help you with selecting those courses so that you can complete those within the first 2 years of your experience here at UNC. The courses on the right will have a little bit different sort of course selection for them, where you can see biostatistics would be more math-oriented, health policy and management would be more economics and business-oriented, environmental health and nutrition would fall back toward the sciences a little bit more with chemistries and biologies and physics. So once you get here, you take a few of your science classes, we start getting a feel for where your strengths are, which courses you have the most interest in. We can help you with selecting an undergraduate major and help you with the admissions process. Some students don't always know at the beginning of their time here at Carolina as a freshman that they know exactly which program they might want to go into. So some students need that 3rd year in their junior year to finish up their prerequisite courses, and they would apply as a junior. We even have some students who finish their undergraduate experience here and realize that really one of these undergraduate programs is where they would like to start their career. So they even apply as a postgraduate as well. So you have lots of options. Don't worry, you're just planning your first semester here at Carolina coming up in the next day or 2, and we will be here to help you with that path should you decide on one of these other majors.
So many of you probably have an interest in attending medical school or another health professional school as a graduate student or after you graduate from UNC. So this is a list of different graduate programs that require prerequisite coursework in those same areas of math and biology, chemistry, or physics. They also require admissions tests, exposure to healthcare, and other experiences that prepare you for a rigorous graduate level science program. Admission is required to these programs, and they're competitive. So requirements for these programs can be done as part of your undergraduate time at UNC, or they can also be done after you graduate. So it's a point to make that, like Joy was saying, that there's no right or wrong path. You can pick a path and you can change your mind. A lot of students try to get all of their coursework and prerequisites and experience done maybe by their junior year so that they can apply to one of these graduate programs and go straight through. A lot of other students, I mean, I would say more and more students now are taking the time to have what's called a gap year, or maybe a year or two after they graduate before going on to one of these programs. Because it's hard to get everything done during your 4 years at UNC. These are programs that really require you to do a lot of different things and do it really well. So it's okay to take your time and really enjoy your time at UNC to make sure that you're accessing all of the different resources that you have and be a really competitive applicant to one of these different programs. Before we dive in a little more to talk about prerequisites and courses and things like that, I want to spend a little time talking about a liberal arts education and the value that it has on your track to healthcare, because it's really an opportunity to be a very well-rounded student. So as part of your degree, whatever you choose at UNC, you'll have an opportunity to take a lot of different classes in a lot of different subject areas. So as a pre-health student, you're probably expecting to take a lot of classes in science and math, and that's absolutely right. But we also want you to take classes in different areas and different subject areas in social sciences and humanities and fine arts. Choose electives that are courses that are just out of your own interest, because being a well-rounded student means eventually you'll be a well-rounded applicant. And the programs that you're interested in applying to are looking for students who know what's going on in the world and can work with a lot of different kinds of people and have an understanding in how different areas outside of math and science affect the patient care that they provide, and provide kind of a diverse perspective on the world. So consider that when you're picking classes that are outside of the prerequisites that you have for these different programs. You know, when you're working with patients in healthcare, or you're working with your colleagues in healthcare, there are going to be situations and people that you work with that are not like you. So the more classes that you can take, and the more ways to engage on campus and to engage through student organizations or whatnot, to really step out of your comfort zone, is a good thing, because the life of a healthcare provider is going to be very different every day, and having opportunities to really take advantage of those resources before you go out into the working world is going to be important. So tomorrow you'll hear more about your gen eds or general education, and you'll hear more about first year seminars and electives. So take advantage of those courses. You're only in college once, and we want you to take courses that can really expand your horizons and give you a nice broad sense, which is what a liberal arts education does. So we know that you are very excited and very eager to get started. Carolina students like to do it all and start off and dive in. It's important to pace yourself. And tomorrow you'll hear a lot from academic advising about starting slow and taking no more than 2 STEM classes your first semester, which is something I hope you listen to. Taking 2 STEM classes, 1 with lab, is great advice that you'll hear. Starting off slowly and kind of setting the pace for yourself early on is really important, because it's very easy to jump in and try every single thing and get overwhelmed right away. And so think about that during your first semester, because we really want you to have a smooth transition. So the most important thing you can do as a first year student is to learn how to study and learn how to study, especially in areas of science. You're going to be doing it in a new and exciting environment. And if all you do this first semester is just get used to being a student at UNC and get used to having this new lifestyle and going to class, that's enough, because there's more to do. And you'll do better at that down the road if you have a nice foundation in your time management skills and studying, and just getting used to going to class and just kind of being a first year student. So this is a screenshot of the Health Professions Advising website, and I want to show you where you can click on Explore to see different healthcare programs and see what the prerequisites are for those programs. So again, you'll see a long list of a lot of different courses for each of these programs, along with the admissions tests that are required and experiences to engage in and things like that. But pace yourself. One great way to get started outside of taking math and biology and chemistry in your first year is to spend some time and look at the list of health professions exploration courses that are on the website. I really want to highlight Biology 117, which is considering health professions. It's 1 credit, it's taught pass-fail, which means that it meets once a week and it's not designed to be intensive at all. It's taught by someone in the biology department, but that doesn't mean it's a biology class. It's an opportunity to hear from different healthcare professionals all across the board. So medicine, dental, pharmacy, PT, PA. This class provides an opportunity for usually 2 to 3 healthcare professionals to come into class and talk about their path and talk about how what they do on a daily basis, but most importantly, how they work together in different areas of healthcare. They'll spend time talking about a course study or a case study and kind of how each of them would attack what to do and how to do it. And how they'll work as part of a team in healthcare. So it's a great class to take your first year. If you're not able to take it your first semester, that's okay. Try to take it your second semester because I think it'd be a great opportunity for you. And we also have first year seminars on campus, which you'll hear more about tomorrow, and I definitely want to highlight those. These are great opportunities for first year students to take because they're small classes. It's an opportunity to meet people on campus, and it's an opportunity to connect with an instructor. They don't have final exams and they're discussion based. It's really a great way to kind of start off your time at UNC and in an environment that is not, you know, overwhelming or too big. So I think they're great opportunities. And the same for the III classes. They're really part of that liberal arts education that I was talking about earlier that provides opportunities for you to get knowledge and experience outside of math and science. And classes that you'll take as part of a pre-health curriculum. So we'll take a break first and listen a little bit to our OLs to talk about what their experiences have been like with courses. So Malia, what are math and science classes like at UNC? And can you tell us what the differences are between taking those in high school versus taking them at UNC?
Yeah, so I'm sure the biggest difference you'll find is the size of the class. STEM classes are pretty big at UNC, generally 100 to maybe 200 students. So they might not be as intimate as you're used to in high school. And you are going to one of the top universities, so they're going to expect that quality of work. So you're going to need to have much more self-motivation applied to your assignments as well as studying. But I think that during your freshman year, UNC gives you an immense amount of resources for tutoring, as well as the extra help that you need to get through those assignments and just learning those study habits that you're going to need to acquire while you're here.
Anna, what was your favorite class that you took during your first year? And tell us if there was a class that you wish you had taken.
Yeah, so my favorite class was actually one I took this past semester. It's Anthropology 272, called Healing in Ethnography and Literature. We explored a rising field called narrative medicine and talked about how the social and cultural aspects of medicine outside of simple biological diagnosis. It's a combined course between English and anthropology, and it's a great example of how the liberal arts can complement medical and pre-health interests. So that was really fun.
Thank you. So this is kind of my favorite part of the presentation because we talk about connections, which in my mind is kind of the fun stuff. It's the stuff that's outside of class. Not that classes aren't fun, but ways for you to get involved on campus and utilize some of the resources I've been talking about. So I think one of the most important resources that you can connect with on campus is faculty. And it feels a little weird at first to talk with faculty outside of class. Every instructor that you have is going to have office hours, which are dedicated time every week, a couple hours a week, where you can just go in and stop by and talk with them. So I encourage you to take advantage of that, because just stopping by and introducing yourself, get used to maybe stopping in before an exam and talking with them about how you're studying and if you're on the right track, or if you have questions about anything. It's important to do that. One, because I think it helps you with your academics in the long run, but the flip side is also that when you're applying to a health professional school down the road, chances are you'll be asking these faculty to write a letter of recommendation for you. So it's a lot easier to do if they know you. They don't have to know everything about you, but if they recognize you and you've had an opportunity to work closely with them and you've done well in their class, it's a lot easier for you to ask for a letter of recommendation down the road. So I encourage you to do that. Student organizations, gosh, I feel like they are really the heart of it all at UNC. There's so many, there are hundreds. heallife.unc.edu is a website that you can go to search, and you can search by title, but you can also search by interest. So if you have an interest in a certain subject or a certain kind of service orientation or something like that, I'm sure that there's an organization on campus for you. You can start one of your own if you're interested in that. But in terms of pre-health, there's the Carolina Pre-Med Association, but then there's also kind of professional school specific organizations. So there's a pre-dental club, there's a pre-PA club, there's a pre-vet or pre-PT and OT club. So I encourage you to seek those out. One, because it's nice to meet people that are like-minded and have the same interests as you. But they also do a great job of connecting you to different resources in the community. A lot of times these are clubs that are going to bring in different healthcare providers or speakers that you can listen to and learn from, but they may be those very same speakers and resources that they bring in may be resources down the road for you to do an informational interview with, or to shadow, or to work with down the road. So student organizations are great ways to get involved. I want to highlight the Campus Y and Carolina Center for Public Service, because as a healthcare or as a pre-health student, getting involved and showing a real orientation to service and helping others will be very important on your path. So finding a way to volunteer that doesn't necessarily have to be clinically related is important. Finding a volunteer opportunity that is important to you and shows what you're interested in and what you're passionate about is important. So the Campus Y and Carolina Center for Public Service are great resources for those kinds of experiences. The Office for Undergraduate Research is great. Research is highly valued by any health professional school. I won't say that it's absolutely required, but it's a wonderful opportunity to try and take part of at UNC. So I encourage you to give it a shot and learn more about it. And you can learn more about it through your individual departments or faculty, but the Office for Undergraduate Research is great, especially for first-year students, to give you kind of an overview of what it looks like and what the process is and how to get started. I've said a lot of words about working with people and understanding different perspectives and needs and values and cultures of the people that you surround yourself with. And one way to do that is to study abroad. The UNC Study Abroad office has so many different programs and so many different ways to study in all different countries. There are summer programs. There are programs that you can study for an entire semester away. There's exchange programs. So it's a great way to really kind of enhance your cultural competence, which is important. and get involved in that way. UNC Global is also a wonderful way to increase that kind of confidence because they have a lot of stateside projects that involve a lot of different global opportunities. And there's also a lot of funding through UNC Global as well. So ways to find out more about scholarship opportunities to allow you to study abroad or to get involved in those kind of opportunities. Exposure to healthcare is important as a pre-health student, really, because it's the best way for you to find out, is this a good fit for you? So by exposure, I mean doing things like shadowing healthcare providers or getting exposure to healthcare by volunteering in a clinic or a hospital or an area like that. You're really finding out, first off, is it a fit for you? But also you're showing these health professional schools that you've done the research to make sure that it's a good fit for you, and they know that you know what you're getting yourself into. So the very worst thing would be that you would apply to medical school or another professional school and get in and then decide, I really don't like this. So as much exposure as you can get, the better. And sometimes that looks like maybe getting certified as a CNA or an EMT at some point in your career or in your time at UNC. But talk with the Health Professions Advising Office about the different options that you have. And again, just one more time to say, you don't have to do all this your first semester. It's a lot. Just start to explore, start to find some ways that you can get involved that are interesting to you, that don't take you away from studying or staying on top of your academics. So it's hard to stay connected to all of this. So I highly recommend doing a couple things. One is going to the Health Professions Advising website, again, at hpa.unc.edu, and joining the listserv. So the listserv is similar to like a newsletter. You send us an email and we add you to this listserv and send you an email once a week or so with different opportunities on campus, whether they're things that have been emailed to us from the community or just different things that are going on. So joining that listserv is very important. And I'll also say that all of these other organizations that I just spoke about, the Campus Y and Carolina Center for Public Service, Office for Undergraduate Research, you can go to their individual websites and sign up for their listservs as well, so that you don't necessarily have to go hunt and look for lots of different things. You can get these emailed to you and you can kind of sift through those on a weekly basis and just make sure that you're staying connected. So again, join the listserv at hpa.unc.edu. I think that's really important to get started. And then last but not least, when you get here in the fall, when you get to UNC, make sure that you attend a Health Professions Advising orientation so that we can go over all of this again in a more detailed format and speak a little bit more to your individual interests. The way to find out about when those orientations are and when those group workshops are through the listserv. So again, join the listserv on the Health Professions Advising website, and I think that'll be a real helpful tool in the future. So.
Yeah. I want to say one thing about this. There is a literal hospital on campus. You will have so many opportunities to work with health professionals. There's UNC, literally, I get research emails all the time. Like, don't worry if you come in your first semester, or even your second semester, that you haven't done, any research or got into anything particular, because I promise there are so many. You will get into something. So.
Yeah, it's so true. It's so true. Sometimes a little overwhelming. You get so many different opportunities kind of thrown your way. So pace yourself.
And that's one of the things I talk to my advisees about is being strategic in where you put your time and your efforts. Rather than doing 20 things, find the things you're passionate about, right? That you can really get involved in and dedicated to. And for those of you that would be applying to medical school or dental school or one of the graduate programs, it's building sort of that passion as you move from your freshman to your sophomore year. The first and second year, you might be involved in an organization. The third year, you take on a leadership position in that organization. And the fourth year, as Mary Charles said, you may do a spinoff and start your own organization. from that original experience that you had on campus. So it's sort of a building of experience as you mature and as you grow and as you develop and you become a different person while you're here at UNC. You're going to be seeking out different opportunities.
So in terms of student organizations and activities, Anna, is there one that sticks out in your mind that you've enjoyed on campus?
Yeah, so one thing I did this year was joining the Asian interest sorority, Kappa Phi Lambda. Contrary to what some people might think, the sisterhood has been an amazing support network and a resource for a lot of connections to both current pre-health students and alum who have gone through the entire process and are now working in the health field. So it's important to keep in mind that there is no one correct path, obviously, to preparing for health professions, and that there are a lot of ways to balance career aspirations, your other interests. So for my example, something that's really important to me is my identity as an Asian American and Japanese American. So there's a lot of ways to get around those interests and passions and possibly even combining them. So, yeah.
Cool. Malia, is there another connection that you've made on campus that has had a positive effect on your experience at UNC?
Most definitely. So I would say faculty is kind of one of the biggest because like Ms. Horn said, they're going to be writing recommendations for you. They're going to open up these research opportunities for you. So during the spring semester, I took a class with Dr. Siganga. She teaches Bio 102, and this was a little bit more intimate class. The class was a lot smaller than normal labs or anything. So I was really able to dive more into the individual research she is doing. And through this, you can actually get so teaching assistant positions, which will look really great on any application that you apply for. So I really advise you to get to know your teachers and professors. They may be a little bit scary, but I promise they won't bite. So really get to know your faculty because they'll be really helpful in the future.
Awesome.
And in getting to know your faculty, one of the first things is to find out how they would like to have communication. So it's finding out if they want you to email with them, setting up appointments with them, if they like drop-ins. Find out exactly how it is that they want to engage with you and what's the most effective way to do that. Students are have really busy lives, and faculty have really busy lives. So it's finding the way to make that connection and find that time to find out how you can have a mutual relationship is very important.
Yeah. So let's talk a little bit about anything you wish you knew prior to your experience at UNC. It's kind of a big question, but I think that's what students really want to hear. So who wants to get started on that?
Yeah, I'll take that. So there are a lot of things I wish that I knew, but I think the biggest thing was to not look at other people's journey or accomplishments so much. Like you have to focus on what you're doing and your goals and where you want to go, because your journey is not going to look the same as someone else's. So you're coming to a really competitive environment, and it's just really important for your self-motivation, your self-esteem to not compare yourself to other individuals and your classmates. So.
Yeah, going off of what Malia said, college is a place where you find your footing, explore your interests, and meet new people. But it is up to you to make those experiences your own. And UNC is a big university, so it is kind of daunting, but choose to have a growth mindset. One thing I wish I knew before starting college is how supportive the faculty members and everyone else are in helping you succeed. And so there's a reason you made it here this far. So don't be afraid to step out of your comfort zone a little bit and get to know all the resources here and take advantage of them.
So important. I think, when I meet with students, you can sense students that really feel like they're supposed to be doing something because they've heard someone else say they have to do it. And I just can't emphasize enough the importance of finding your own path and making it work for you. And just like what these guys were saying, it is a big university, and there's a lot of different resources and a lot of different just opportunities that are thrown at you. Don't be afraid to be yourself and pick and choose and do what you want to do, because it's easy to get sidetracked.
Some students will say, you know, oh gosh, it's such a big campus and so many students. And, you know, if you went to a campus with 5,000 students, or you're going to a campus like this with 26,000 students, you're still going to have the same core of 10 or 15 people that you become close with and you work with as students. And you're going to become close with 3 to 5 faculty who know you very well, and you have that experience. So understand that you'll get all the advantages of being at a large campus and what we have to offer, but you'll still have that same nucleus of people who will shape your experience and will walk that journey with you for the next 4 years.
So well said, Joy. Well, I really appreciate you guys taking time to watch this. I hope you stay connected to us this summer. I ask that you go to this QR code and fill out this survey. It's super quick. It's only 4 questions. We're just hoping to get your name and your PID and email and your health profession interests so that we have a better sense of what you're interested in, and we can make sure that we're creating programming that really supports what you need. So if you can take time to do that, we'd really appreciate it. And of course, connect with us on social media. We're on Twitter and Instagram and Facebook. So have a great rest of your summer, and we'll see you in the fall.
And if you want more information about some of the other majors, since we concentrate on health professions advising, we really encourage you to listen to some of the other videos for the more than just a major, for the STEM, for those of you who are thinking about a science major, but there's also things for social sciences, business, etc. And again, one more time, you can major in anything and go into a health profession. So please take the time to listen to some of the other more than just a major sessions.
That's right. All right. You guys have a great summer again, and we'll see you soon.
See you in the fall.
Bye, guys.
Bye.
Thank you.